everybody, and welcome to the Tuesday, January 4th, 2022 meeting of the Lane County Board of Commissioners. This is a regular meeting. The first item on our New Year agenda is adjustments to the agenda. Do any commissioners or staff have any adjustments to the agenda? The next item is Commissioner business. 1A, it feels odd for me to say this, but I have to because I'm the chair for another minute. Presentation of award to current board chair, Chair Burney, and this will be Vice Chair Farr.
Thank you, Chair Burney. And before I present the award, I'll take one moment to say thank you for your year of service as chair of the Board of County Commissioners. You've done a great job. One thing that I've appreciated greatly is your style in allowing other commissioners to talk before you talk, and you adhere to that very strongly. I think that you've done a superb job of managing the meetings and allowing for complete access, complete participation. Chair Burney, I salute you. My hat's off to you. And with that, I will hold up in front of my face, I presume in front of my face, what is in fact your award. And if you look at that end of the gavel, your name is inscribed upon the gavel, and this is yours to keep when you leave office sometime 12, 16 years from now. You can take this with you. So Chair Burney, once again, thank you very much. Here's your award.
Where? I want it.
It will be placed on your desk.
Thank you. Thank you very much, Pat. Forgive me, I'm going to be a little less formal at this moment. And Heather, and who's gone with me through this every moment I've been a commissioner, and Lori and Jay and Steve and everyone, thank you so very much for your support, your friendship, and I mean that, and your collegiality. This is the quote that I came up with, which really sums it up. It's from Chief Joseph of the Nez Perce tribe. And it says, "It does not require many words to speak the truth." And my truth is, it's been an honor, and thank you all very much. And I believe I now remotely am turning, no, I get to be chair for one more item, don't I? Okay, item 1B, election of chair. Are there any nominations for any members of this body to be chair for the 2022 calendar year? Commissioner Trieger.
Thank you. Good morning and Happy New Year, everyone. And congratulations, Commissioner Burney, on completing your term as chair, and much appreciation. I'd like to nominate Vice Chair, currently Vice Chair, Commissioner Pat Farr, to be the next chair of the Lane County Board of Commissioners.
Thank you very much, Commissioner Trieger. Before we go on, Vice Chair Farr, do you accept that nomination?
If it is seconded, Chair Burney, I will accept the nomination. Thank you.
Thank you. Is there a second?
Second.
Okay. Commissioner Trieger has nominated Vice Chair Farr. It's been seconded by Commissioner Bozovich. Are there any other nominations for chair of the 2022 Lane County Board of Commissioners? Seeing none, Mr. Mokrahajski, do we need to vote? I think I would know the outcome of the vote, but nonetheless, is that required? We do or do not? We do. Is there any discussion to the motion? Well, I would like to at least say that Vice Chair Farr has my complete support, and I think we're just going to be in really good hands. And Vice Chair Farr, you already said you would accept the nomination if seconded. Commissioner Bozovich is holding you to it. All those in favor of Commissioner Farr for chair, please signify by saying aye.
Aye.
Opposed? Commissioner Farr, it's my honor and pleasure, actually, to give you the gavel and ask you to run the meeting. And congratulations, sir. We'll be looking forward to working with you as our chair.
Thank you, Commissioner Burney. I appreciate the year that you put in, and I look forward to a great year ahead of us. Then with that, we'll move ahead on the agenda with item 2B, which will be election of the vice chair. Ever so quickly, prior to accepting the nomination, I'll mention to anybody who may be confused, if you look at Commissioner Business item 2A, it calls me Par Far. And my name is still Pat Far. So I'm trying to keep up the par. Nominations for vice chair, Commissioner Burney.
Chair Parr. I would like to nominate Lori Trieger as vice chair.
I'll second.
Nominated by Commissioner Burney, seconded by Commissioner Buck. Any further nominations? I see and hear none. I'll close the nominations and call for the vote. All those in favor of Commissioner Trieger to be elected vice chair, say aye. Aye.
Aye.
Opposed, if any? None. Passes unanimously. Vice Chair Trieger, congratulations and welcome to the agenda setting team. Our first meeting will not be next week because we don't have a meeting the following week. So 2 weeks from now, we'll have our first agenda setting meeting. Then moving down the agenda, we have a long and storied consent calendar. But prior to that, moving to item 3, any emergency business. I see and hear none. I will say, just for the record, I see 4 commissioners are the only faces that I see on my screen right now. So if any staff member wishes to get my attention, you can do so by raising hand or by an audio signal, which would work better on the agenda, which is public comments. Speakers will be taken in the order in which they sign up and limited to 3-minute comment. If the number wishing to testify exceeds 10 speakers, additional speakers may be allowed if the chair determines that time permits. That's never been an issue. We've always permitted any speaker to speak. There is additional opportunity for public comment occasionally in the afternoon. There will not be today. And if you wish to provide written testimony, please feel free to do so. At this point, we'll open the public comments. Ms. Jones, is anyone signed up for public comment?
Thank you, Chair Farr. At this time, our public comments will be taken remotely. We have started with a new platform today, so if you have signed up for public comment, you should have a virtual hand that you can raise. I would ask you now to raise your virtual hand if you would like to give public comment, and I will go down the list of speakers. Just a quick note, please only press your virtual hand once because it is a toggle and it will go up and down and I won't see it if it goes down. With that being said, we do have people signed up for comment. I will be Danny Marino, followed by Tony Corcoran. Danny, I will unmute your microphone and you may begin your public comment.
And she's got a couple good conversations.
We
All right,
do
can
have
y'all hear me?
Yeah.
Awesome.
Chair, if I may, Mr. Moker Heisky, I think your mic is on. Forgive me, Chair.
All right, can y'all hear me? Good morning, Happy New Year. Congratulations, Chair Farr and Vice Chair Trieger. May light and good guide you always. All right, so I have something prepared for you today. I'm gonna start by sharing 3 facts. And the first one is that a huge amount of people got to see what she said in 2021. And in return, we are getting more cases and deaths than in 2020. We got cruises and colleges with 100% vaccination rate.
I don't know how you have like
we
an
are
Moment, please. Someone has the mic on.
I'll be honest with you. I don't know that I'm comfortable going.
Excuse me, I believe that's Mr. Rickoff who's not muted.
We have people unmuted or muted.
I believe that's Mr. Rickoff who's not muted. Just looking at the icons on the screen. And I'm wondering, pardon me, Diana, do we have a clock available for our public commenters?
Yes, I was just going to jump in and say I'm going to switch to the clock as well. Sorry, I was dealing with the muting issue. So, Ms. Marino, I'm going to put you on pause for 1 second and we'll start your public testimony over. 1 moment.
Sure.
With a full 3 minutes. Thank you, Diana.
Hey, Ms. Marino, you may begin your public comment.
All right, thank you all. Three facts: a huge amount of people got 2 to 3 vaccine doses in 2021, and in return, we got more cases and deaths than in 2020. Cruises, colleges with 100% vaccination rate are experiencing outbreaks. And I checked again, and gratefully, we are still at 5 people from ages 0 to 19 years old reported as COVID-19 deaths in Oregon. These are the 5 that I found that had persisting conditions. So I would say that the lack of safety data on the vaccine is the real danger for kids. Here's one concrete idea.
I've lost audio.
All right, new technology.
Marie,
Yes.
Ms. Marie, looks like you muted yourself. You've just muted yourself again. Can you unmute yourself? There you go.
Okay, I think Zoom is doing things on my behalf. All right, sorry about all these things. So I was saying a concrete idea that instead of continuing with the mass vaccination efforts, if we could switch to regular vaccine distribution, we could save a lot of money, and we could maybe put that money towards making our hospitals bigger to account for population growth. I have 5 questions for everyone, not just for the commissioners, for everyone to think about. What is the reason for freaking out about Omicron if most cases are asymptomatic? Why don't we hear more about the fact that viruses become less pathogenic as they evolve? Can we officially call Omicron the variant of the vaccinated? The CDC requested that PCR tests be replaced with tests that can differentiate between SARS-CoV-2 and influenza as of December 31st of 2021. Why is Biden spending billions of our tax dollars on PCR tests? I hope this makes you wonder, how many COVID cases are actually influenza? If a virus with the less than 1% mortality rate enables censorship, medical abuse, coercion, discrimination, what would happen with a more serious pandemic? Let's be careful because we are being cornered into walking a very thin line. 3 requests. The Oregon vaccine tool is for social segregation, even though they tell us no, don't worry. We are very much worried. We are going to block it as much as possible. Please don't let this happen. Please list up the mandates in general, and let's say no to the indoor masking. And I will stop at that because I got very distracted with everything else. So yeah, please don't allow the Oregon vaccine digital records and the indoor masking. Please, 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 please. Thank you.
Thank you, Ms. Moreno.
Thank you.
And Diana, you'll manage the queue on this, is that correct?
That is your call, Chair Farr, but that's what I have been doing, yes.
That will be my call. Thank you.
Okay. Our next speaker is Tony Corcoran. Tony, I will unmute your microphone and I'll start the timer and you can begin your public testimony. You will be followed by Harry Sanger. Tony, I show that you're self-muted.
Good morning and Happy New Year, Chair Farr and Commissioners. Can you hear me now? Okay. I'm an independent redistricting committee member representing District 5. I'm here today in support of committee member George Greer's written comments and questions submitted to you today. Since county staff informed me there will be no public comment specifically around the IRC, but there is public comment every meeting, which is open to any topic for 3 minutes. So I'm here to talk about feasance. Feasance is defined as a legal term for how something is done or accomplished. As a committee, we convened over 20 times last year, so I was disappointed to learn last December 14th that our findings would not be implemented because of a known deadline. In late December, I asked our IRC chair, Morgan Monroe, to convene the committee to require a public explanation from Council Dingell. The chair replied the committee was disbanded. She wrote, "There is no avenue for our committee to be reinstated, and any next steps about addressing the infuriating deadline error are entirely in the hands of the commissioners. As constituents, we may provide public comment to our commissioners, but the previous members of the now defunct IRC are not in a position to call a public meeting or require county staff attend. The important questions and concerns that you have all raised about the deadline being missed should be directed to our commissioners." I disagreed with our respected committee chair. Our redistricting plan has not been implemented. The public deserves some answers. How did Mr. Dingell first become aware of the missed deadline? What led him to believe his stopgap measures were sufficient? Who, what, where, when. Then let the public decide why all this happened. So here I am today. I believe anything short of some explanation would indicate the commission's ongoing endorsement either of Mr. Dingell's malfeasance or at worst, or his misfeasance or nonfeasance, the intentional failure to perform an official duty or legal requirement at best. I'm not a lawyer. I don't know the difference. I talked to a friend of mine, a local lawyer known to the board. He said he grew up in Texas, so he'd seen plenty of political shenanigans in his life, and he concluded, I couldn't tell you if this was malfeasance or misfeasance at this point, but there's definitely plenty of feasance going on. So as Mr. Greer stated in his memo to you, we deserve a public explanation and a plan moving forward. Thank you for your time.
Thank you, Senator.
Thank you for your public comment. Our next speaker is Harry Sanger. Mr. Sanger, I will unmute your microphone and you may begin your presentation. Mr. Sanger, I do show yourself muted. There you go.
Thank you, Ms. Jones. Happy New Year, everyone. Commissioner Burney, thanks for your service as chair. Congratulations, Commissioner Farr, or Chair Farr now, and Vice Chair Trieger. I wanted to speak to a couple things today. The last speaker, Tony, brought up some great points, and I'm a perfect example. I reside in District 4 at the moment, and under the new redistricting, I'll be in District 1. If I wanted to run as a county commissioner, I'm ineligible to run for District 1 this year, and I'll be ineligible to run for District 4 when that comes up as well. So I'm stuck. I have no option to participate in governance because of the shenanigans around the new map. Speaking of shenanigans, can we please start looking at the science around COVID? You kept saying follow the science until the science said something you didn't like, then it was follow the fear. We need to stop following the fear. We need to open our society. We need to stop the segregation. I was lambasted by the River Road Community Organization, and they are writing a letter to you as we speak to denounce the actions at the Howard Elementary Vaccine Clinic. I asked the commissioners to dialogue. I called Commissioner Farr and received no response. We want a dialogue in our community. Neighbors didn't want an experimental mRNA shot clinic in the neighborhood. And nobody would approach the neighbors. Nobody would talk to them. You did what you wanted to do, and you ignored your constituents. You please need to start listening to your constituents. The state is implementing a digital vaccine passport, and they say it's voluntary and optional. But we all know that what's voluntary and optional today becomes required tomorrow. St. Vincent de Paul is one of the strictest companies on the mask mandate, and I believe that's because they take money from the state municipality, and if they don't enforce the masks with the fervor that they do, they lose that money. When the state digital vaccine passport gets tied to state grants and state licensing agencies, so any restaurant that's licensed by the OLCC, any bar, liquor store, will all have to mandate this passport in order to keep their licensing. They say it's optional now. We all know that is not true. We all know that what is going on in our society that you all have been complicit in has damaged the mental health of our community, has weakened our social structures. We need to take off the masks today and see each other's faces and see our smiles. You need to meet in person so that you can see us and that we can sideboard and we can talk to you. We can talk to each other. This virtual world doesn't work. You know it doesn't work. The government's coming out and saying now cloth masks don't work. We've been saying that for months. Omicron is spreading more rapidly but less virulent. We knew this for months. This is all predictable. Please show some common sense. We look forward to the new year and new hope. Thank you.
Thank you for your public
Thank you, Mr.
comment.
Singer.
At this time, I do not show any other hands raised to speak. I will make one more call. One just went up. I do see that Linda Wiley just raised her hand to speak. Linda, I will unmute your microphone and you may begin your presentation. If anyone else would like to speak following Linda Wiley, please raise your hand now. Linda, I do show yourself muted. There you go.
All right. Hi. Good morning, everyone. Boy, this is such a heated issue and such a challenging thing to speak to. But I want you to know that there's so much illegalities going on here. Mandates are nothing unless we agree to them. They're a suggestion, they're not a law, they're nothing. And you have overstepped your bounds, overstepped your rules. The Federal Trade Commission Act, you have gone against. Deceptive Medical Practice Clause, you have gone against, and against medical advice. There is no actual proof that masks do anything whatsoever. The vaccine is not even a vaccine. It's a gene therapy, experimental. It compromises the total immune system. The United Kingdom government have come out absolutely against it, stating clearly the harm done to humanity through this vaccination. If you look at VAERS, which is the Vaccine Adverse Reporting Event symbol situation that doctors are supposed to report to, there have been hundreds of thousands of harm done from this vaccination. So many people have been harmed. There have been deaths, hundreds of, thousands and thousands of deaths from the vaccine. How can you possibly, in your right mind, this is crimes against humanity, 100%. It is, I can't even tell you the upset about it. There is no scientific proof about any of this. The inventor of the mRNA vaccine has come out and said, don't get this shot. It's not even a vaccine. It doesn't prevent transmission. It doesn't prevent breakout. What the heck is it then? It harms the body. It harms the immune system. So many doctors are speaking out against it now. So many lawyers are speaking out against it. There's so many suits. Why be on the side against crimes against humanity? Allow freedom. Allow people to go through. There's a 99.6% recovery rate. The vaccine is completely unnecessary. The body's natural immune system is destroyed in the process of what's going on. Everything that you're doing creates harm mentally, physically, spiritually, emotionally. The Hong Kong flu went around in 1969 when Woodstock was happening. No vaccinations, no masking, no nothing. It dissipates through the community. The way you're running it creates and promotes more of this variant, more of this stuff. The variants are also a lie. They're covering up the harm done through the vaccination. So many vaccinated people are what's sick and what is driving it, not the unvaccinated. Our bodies remain clean and pure as nature intended them to be. I ask you to look and think and consider deeply what you're doing, because what you are doing is crimes against humanity and creating more harm. Thank you.
Thank you. Thank you for your public comment. At this time, I do not show any additional hands have been raised. So Chair Farr, I will turn the meeting back over to you.
Thank you, Ms. Jones, and thank you to the folks who provided public comment this morning. At this point, it is time for the commissioners to respond. So we have an opportunity now, commissioners, for response or remonstrance. And I can see your hand, so give me a visual sign if you wish to get in the queue. I see no one in the queue for a response. Going twice and moving along. Thank you very much. Excuse me. I'm brand new at this. So moving along to-
Chair, could I say something? I'm sorry.
Yes, please. Commissioner Burney, please.
The transitions take a while. I want to echo Chair Farr's appreciation. And I want to respond to the whole redistricting fiasco. The redistricting was not a fiasco in my opinion, but the time frame for implementation based upon what commissioners thought turned out to be one. I want Mr. Corcoran and those that signed Mr. Greer's letter to know that I'm not the only commissioner that shared your frustrations. We've already seen how this is being used by some to, for political purposes. our understanding is there's really, given the Lane County charter and time frame, not a damn thing that we can do as it relates to next year's elections. My understanding, and Mr. Mokrahysky or Mr. Dingle, you can correct me if I'm wrong, my understanding is the district boundary lines that were proposed by the IRC and adopted or approved by a majority of this Board of Commissioners will in fact be in place, just not for, because of something like a 6 or 7 day time frame, which we should have known up front, which we should have been aware of, or should have been branded on us in every public meeting that we discussed this, so we knew what the time frame was. And it did not occur. We learned this after the fact. We thought when we were making those redistrict lines, it would impact the 2022 elections. So you're not the only ones that are frustrated with the process. Thank you, Chair.
Thank you, Commissioner Burney. Any further remonstrance or response? Then I see none. At this point, the Board of County Commissioners will move into recess, and I will reconvene as a joint meeting of the Board of Health and Board of Commissioners. Recessed and convened as a joint meeting. First item on today's agenda for the joint meeting of the Board of Health and Board of Commissioners is adjustments to the agenda. Do I see any adjustments to the agenda? Seeing none. Any emergency business? I see none. Moving along to item 3 on the joint meeting. County Administration, we will have a discussion of COVID-19 response and recovery. Mr. Mokrahysky, I will turn it over to you to introduce Mr. Adams and other participants in the panel. Mr. Mokrahysky.
Thank you, Chair. And we will have a more lengthy update today. We have Steve Adams and Dr. Warren with us today, as well as I believe Dr. Ludke is with us to answer questions. There have been certainly some significant changes in the pandemic with the Omicron variant. And so you hear an update on that. And I think it will be especially valuable for the board and members of the public to hear from our public health officials to dispel any misinformation, give you the best facts that we have available to us. So I'll turn it over to Mr. Adams to walk you through the update.
Okay, thank you so much, Mr. Mokrahysky. Chair Farr, Vice Chair Trieger, and Commissioners, Happy New Year. It is a delight to be with you this morning, the 4th of January, 2022. Joining me this morning for this briefing is Dr. Warren, our public health administrator. Dr. Ludke is not with us this morning, but we are working to have him join us next Tuesday for the update to this board. So I am, let's see, bringing up my Okay, so I believe I am sharing my screen in this new interface. It takes a little bit of getting used to. All right, so beginning this morning with our forgive me. There we are. Our current status. So these data are current as of yesterday when I put these slides together. So we are reporting as of yesterday 32,995 cases. And since I put this deck together, we have actually gotten this morning's data reported to us. So we're reporting as of this morning 33,432 cases. That is an increase of 437 that have come through in the last 24 hours. I should note that these are delayed case reports coming from providers who were providing to us on a next business day basis as opposed to a 24-hour basis. So 437 is not representative of the number of cases detected in the last 24 hours, but those are the reports that are coming in. So the 33,432 cases now reported is showing the full extent of the cases that have been detected over the last several days. And of course, as we come through the holiday period, we are seeing data reporting lags. We now are tracking 1,361 individuals in Wayne County as currently within their infectious period. 33 individuals, Wayne County residents in hospital this morning, 7 of whom are in ICU residents to date. And just really to kind of put this into context, I took a little bit of holiday time off. I left on December 17th, and many folks took holiday leave. We've added 2,331 cases just in that 2-week period of time. So we are starting to see an upward surge in cases. On the 17th of December, we were reporting a case rate within the county of 95.7 per 100,000 of population. That had us within the substantial spread range, just under high spread, with the CDC threshold, the opening into the highest level of community ranking is 100 cases per 100,000. So with these updated this morning, we're now reporting 372.3 cases per 100,000. And this, of course, is putting us quite high. You'll recall that at the very peak of the Delta wave, and now as we see the epi curve for the entirety of the pandemic, we peaked at 420 cases per 100,000 back in the fall as we were dealing with the Delta wave. So indeed, we are seeing the Omicron wave. It has hit this part of the world and is very quickly showing up in our case rate. I am pleased to report that from all indications, and we have seen this reporting elsewhere, first in Africa, where it was first recorded and reported around the Thanksgiving timeframe about 5 weeks ago, when the World Health Organization declared Omicron as a variant of concern. It's seeing second reports in Europe as cases began to increase there, a decoupling of the case numbers and some of the disease severity. So the hospitalization and the reports of severe disease have been lower with Omicron than we have seen elsewhere. Now, there was important questions still with the science. You know, you have to think about the relative age of a population. The South African population is much younger than the population here in the United States or here in Oregon. And, you know, different vaccination rates and all of these other factors really have to come into play as we begin to think about how is Omicron going to affect us here in Oregon and specifically here in Wayne County. And it is playing out. We are seeing the high degree of transmissibility. We expect that our cases will continue to rise at a very rapid rate. And we are continue to see thus far that the degree of severe disease is much less with Omicron than is the case with Delta. We're also beginning to see evidence that the factors that we have been most concerned about, the extent to which previous infection with Delta or other strains of COVID-19 or prior vaccination status, both fully vaccinated with the first and second and boosted, are performing well in terms of limiting disease. So we're seeing just out of the UK some really important data on a large scale population published over the weekend that is showing that Omicron is about half in terms of what Delta was presenting for resulting in severe disease. We're seeing reductions in individuals who are fully boosted of almost 90% protection against severe disease. So yes, we are seeing infections amongst individuals who have vaccinated, but the vaccines are performing as advertised. They are helping to protect against severe disease. Nonetheless, and as we look at our vaccination status, we can certainly celebrate that over the, as we concluded 2021, we did cross the 70% mark. We are now reporting as of yesterday, 70.4% of our population here in Wayne County has received at least one dose of COVID vaccine, and the vast majority of those individuals are fully vaccinated. And we continue efforts to move the needle on boosting. So for our 65 plus population, we're reporting this morning that we're now over 56% of that population has been boosted. And we have another significant component of those individuals who will require boosting. And then we've made progress over the last few weeks on our 50 to 64s as well. They've moved from about 20% to about 34% boosted just within the last few weeks. Now, as we look forward, these are some of the concerns that I think the governor has articulated and we're seeing specifically statewide. So Oregon Health in Science University has put forward OHSU's hospital forecast specifically. So as of, and they just pushed these data out again and refreshed these data on Friday of this past week. So as of Friday, we had 455 individuals in hospitals statewide within Oregon, confirmed COVID-19 patients. Now, as they project with using a number of assumptions that really are drawing from observations in Europe, the UK and Western Europe elsewhere, really projecting forward that we will likely peak in terms of a hospital census by the end of this month. They're projecting 1,600 in hospital by the end of the month using the model. And we're starting as of 4 days ago with 455. So this would be kind of a ×4 of our current hospital census. This would exceed where we were with Delta. This is not as dire as the initial forecast that OHSU presented 3 weeks ago. So we're pleased to see some of that, and some of that is just a function of the assumptions that they're using to define this activity. So as you all will recall, back on the 24th of August, this board passed 5-0 an emergency public health advisory in which we, in the run up to Delta, really kind of urged individuals to take common sense measures to protect themselves against Delta. And I'm pleased to report that I think there's pretty significant evidence that Wayne County did respond well to the Delta surge. We had a high number of cases. Our mortality rate was lower than other comparable counties, and our vaccination rate has continued to increase throughout that period of time. So with this public health advisory, the team here, the staff, are working to make some specific adjustments and continue to communicate out on some of the particular areas. So we're advising the broader public here within Wayne County to seek vaccination and boosts if they haven't already done so. Moving forward with vaccination is the single most significant thing that you can do to protect yourself against significant disease, severe disease, hospitalization, and for those most at risk, death. We're reminding folk, and we understand the fatigue that is there, that masking, appropriate, well-fitted masks are the best thing that you can do as well, in addition to vaccination. And then all of the common sense non-pharmaceutical interventions, social distancing, hand washing, and the other items that we all know work. These are the things that folk can do over the next few weeks to help us get through this surge. Now, we see, I think, the inevitability. We are likely to see many people in our community contract COVID-19 over the next few weeks. These case numbers will go up. This Omicron variant is more highly transmissible than anything that we've seen before. We're seeing a milder disease as a result of this thing. In many ways, this is a good thing. We're seeing obviously less people who contract COVID go to hospital, but it's just the sheer number of individuals specifically who we think are likely to contract COVID in the next few weeks here in Wayne County And just it's a numbers game at the end of the day. And so these, as we work with our local hospitals to manage capacity, these are some of the factors that we're most concerned about. So with that as a kind of status report, I'd like to hand over to my colleague, Dr. Warren, to give you a bit of a briefing on kind of how do we stand today, January 2022 versus where we were a year ago.
Thank you, Steve. Chair Farr and Co-Chair Trieger and commissioners. Thank you. I'm here to give a little, potentially a little ray of hope, maybe. We don't have a bright picture for the next several months with the Omicron surge. We are definitely going to need to double down again as a community, and we've done that in the past very successfully. But I also want to emphasize that this is not January of 2021. Going forward, we are going to need a lot more space here, I think, on the y-axis. But going forward, and Steve, if you want to go to the next slide, thank you. We know that's different now because we have vaccines, and this is really something to celebrate. We have 3 very effective vaccines and boosters, and potentially more on the way that prevent, as Steve mentioned, severe disease and hospitalization. Vaccines have not been necessarily the game changer we had hoped for in 2021 because there's been a lot of politicization and misinformation and sort of cultural polarization in the US. But the availability and distribution over the past year in Lane County is really something that we can celebrate as a community and be proud of. And we continue that effort as well. Also, and this is, I think, also really important, the rapid development of messenger RNA vaccines has benefited research in a wide range of areas. And so we can expect to see accelerated advances in things such as Zika and cancer prevention as well. The second reason we are not in January 2021 is that we know so much more now in 2022. We know a lot more about the SARS-CoV-2 virus and the existing variants. We know a lot more about COVID disease as well. We've learned how effective the non-pharmaceutical interventions are that can help us protect each other and ourselves. Effective hand hygiene is well understood. We've also learned a lot more about masking and how to make it more effective. We know how to do social isolation, although it's not something that any of us want to do. It is effective at reducing transmission. And we also know the importance of good ventilation. And finally, I think we're all learning how to use our own best judgment in reducing risk for ourselves and our families. We all have to make those decisions about the level of risk that we're willing to take and how to really protect those who are most vulnerable in our community. And number 3 is testing. Although it's not nearly as easily available in the US as it should be, it's still far more available than it was in January 2021. And we really have to give special thanks now to the Mackenzie Willamette Lab, which has been a great partner with Lane County Public Health, and to the University of Oregon. Their saliva test in particular has been a really boon to schools here locally. And we really appreciate that effort for sure. And then over-the-counter rapid tests are more available, not as available again as we would like them to be, but they should become more available in the upcoming months. The state has ordered 12 million tests. They're expected to come this or next week. And we are expecting about 400,000 of those to come directly to local public health for distribution. And treatments, of course. We have many new treatments and more are under development all the time. The FDA list of approved treatments and those that have been given emergency use authorization changes frequently. So it's important to kind of check the FDA list. We do have hospital treatments such as IV remdesivir, and that's alone or in combination with other drugs. And now we have outpatient treatments, including the monoclonal antibodies and oral antivirals, which is very exciting, such as Paxlovid and molnupiravir. Availability of these and new treatments combined with the greater vaccination rates and boosters may mean that in 2023, we are finally talking about something other than COVID. And that's why we are somewhat optimistic. And hoping to give some reason to be more excited about the new year, although also having to recognize that the next several weeks are not going to be easy ones here in Lane County. Thank you. Chair Farr, you are muted.
Thank you. I muted myself to avoid my coughing noises. Thank you, Dr. Warren and Mr. Adams. Mr. Mokaraisky, any further staff presentation?
I think that's everything from us for now, Chair, but we welcome your questions and comments.
Well, we've written down some good quotes. I'll for the Board of Commissioners, questions and comments. I can see each of you, so visual cues work really well. Commissioner Buck.
Thank you, Chair. I had one clarification question. I just want to make sure I heard this correct. So you mentioned 370, we are at 372 cases per 100,000. That was accurate? Okay. And I noticed in the resolution that you posted of ours earlier, that exceeds what the number was right at that time, which I think was very close to our peak of Delta, if I remember correctly. And I think we just now are hitting the Omicron variant and not nearly at our peak. So in advance of the impending hospitalizations, I was hoping for a reminder of how many hospital spaces we have again here in Lane County, knowing that right now we have 30.
At the time in which that this board acted to make that emergency public health advisory, we were below the 370 that we are at now, and this is going up fast. So we're essentially looking at 2.5 weeks and a factor of 4 from where we were, and we think that is not unexpected to continue at that relative rate. This is going to burn through much faster than Delta did. So we will go up. When we look at our hospital beds, you'll recall that one of the issues that we ran into in Delta was that here in Oregon, essentially Eugene, Springfield, Wade County is the second largest regional medical hub in the state, second only to Portland, and that we're essentially responsible for all of South and West Oregon. So we have significant transports coming in. So that number of 33 Wayne County residents that we're reporting this morning is just one piece of the puzzle. We're at, and I haven't seen the HOSCAP update this morning, but as of yesterday, we were in the low 40s for hospital total COVID patients. And that difference is folk being transported here. So with lower vaccination rates to the south, and we can anticipate that this is going to ramp up. Now, the number of beds that are available locally is really kind of a function of how many can be staffed. So that number goes up and down. We can surge into more ICU beds as needed. We're seeing less individuals needing ICU with this particular variant, which is really hopeful. This is another piece where we're thinking this is, where we're seeing less severe disease, and we think that this could have less impact, but it really is a function of how many. And then, of course, the next kind of trigger point for our hospitals will be severing or stopping other procedures and other care. So as we get past 50 COVID patients and start approaching 75 COVID patients, that's when they're going to have to defer care. And that then creates more spaces for COVID patients. But we have seen very little in the way of hospital bed availability over the last several months, even after we eased up on Delta, because the hospitals have been trying to catch up on deferred care. And that we've seen that the hospitals have to stop care 3 times since this pandemic began.
Chair, if I might just follow up, you had mentioned when they reach 75 beds full, that's the limit where they need to alter who is getting care, or maybe those other surgeries or things that had been scheduled. But you didn't mention if that is the average amount of available beds. I know it fluctuates.
It
but I'm
does.
guessing that we're going to get there by sheer factor of numbers pretty quick, and hopefully not too many in the ICU.
That is correct, Chair Farr, Commissioner Buck. I am pulling up the HOSCAP even as we speak, and I will see what we are showing, if I can find the number. Okay, Chair Farr, perhaps I can come back to this number in the interest of time for Commissioner Buck.
With your agreement on that, Commissioner Buck, we'll come back to Mr. Adams on that response. Thank you. Other board members. Commissioner Bozievich, followed by Commissioner Trieger.
Thank you. First, I'd like to try and make a data request for some of our graphing on our data dashboards and all that, because I try and review those rather regularly. And I was noticing that the time period was limited on some of the data to where I couldn't compare the current start of the surge with the start of Delta. Because either I had to show the entire pandemic from the beginning where the graphing was difficult to look at, or I could get only a couple weeks on some of the graphs, or as much as 4 months, which missed the peak of Delta. So just at some of the data, having the ability to see to look back to the last surge, for comparison, because we all understand what Delta was. Second, there is no trending data for hospitalization, ICU use, or deaths really easily available on our data dashboard. There's detail of the current hospitalization, and they'll tell you everything about demographics and everything, but no trending. There's no historic graphing on that, so there's no way I can understand how our current hospitalization looks compared to Delta. So that's just, if those two data requests would be great. And I'll just say this about OHSU and their projections. I've had to bookmark and save past OHSU forecasts because they tend to disappear on the internet. But I've gone back and looked at them, and I can't tell you how many times they've been wrong. They're usually wrong on over-projecting peaks and wrong on over-projecting how fast we're going to fall off in both directions. So as you look at, as you look at projections, understand their mathematical models, and they can be wrong. They're the best estimates, and they have been wrong consistently. And basically, they've over-projected peaks and under-projected valleys, which mathematical models tend to do, having worked with a lot of them over my career as an engineer. The question I have directly, Steve, is Dr. Fauci recently came out and admitted that multiple data points of our hospitalizations, particularly for minors, were people that were admitted to the hospital for some other reason, but then tested positive for COVID, and they're counted as a COVID hospitalization. So a kid that breaks his leg and ends up in the hospital recovering from a broken leg, but then tests positive for COVID, is counted as a COVID patient. Is there some way of knowing how much of our data for hospitalization is people hospitalized and then tested positive, or people that entered the hospital because of their COVID disease?
Chair Farr, Commissioner Bozievich, first, thanks for the feedback on the 2 data points. Just the time frame piece and the trending. It's extremely helpful. we're always looking for kind of additional eyes on these data to help us really kind of tell the story that these data tell. With regard to OHSU projections, that's my experience as well. And I tend to save them as well, Commissioner Bozovich, so that I can see what they look like. And I've observed what you have as well. So I'm just wanting to validate that observation of yours. It's spot on. With respect to the hospital data that we're seeing, and I think this issue of with Omicron is going to be more prevalent, where we will have individuals in hospital for other purposes who contract COVID because of the transmissibility of this thing. I think that certainly I did not hear the remarks, but I read of them by a second remark, and it struck me because we were also hearing anecdotes coming out of Africa and Europe that we were seeing in congregate settings much more rapid transmission, even at greater distances. People were quite a far distance from other positive individuals and yet contracted COVID. So I've been thinking about that in that context. Whether or not we could see a difference in those patients, I do not know if there is a coding mechanism that we could use, but it's something that I will absolutely explore with the team here and understand if that's something that we can see. My fear is that the sheer number of cases is going to make it increasingly difficult for us to really understand the circumstances around any one case. It is important contextual information, but I am concerned about the capacity that we have to really drill into each of these cases at the moment.
And I think that happened during Delta, where we got such a large number of cases, we weren't even able to do a lot of contact tracing and figuring out source, et cetera. So I get that. The larger the numbers, the harder it is to keep good data. So I really appreciate that. And I look at these numbers not only for my job as a commissioner and trying to make decisions for the county. My wife has a business that runs tours in Europe, and we've had to cancel multiple tours over the past several years. And we have tours scheduled for late spring this year, early summer, that we're now having to try and make decisions around. So trending data and all that stuff, I'm not just making, so I look at this data very critically and often trying to help us make business decisions around that tour business and whether or not we're going to be able to run a tour in England in May. So that's part of my reason for asking for that and why I look at the data so much and so critically.
Thank you, Commissioner Bozovich and Mr. Adams. And Commissioner Trieger, prior to your stepping into the queue, a procedural response that I'm going to make. It's not been the policy of this board or any other board that I've served on to answer questions live during work sessions or even during public meetings. We will not be answering questions that are coming up in Q&A live at this point in time. You can submit the questions in writing to the Board of County Commissioners and responses will be provided, but there'll be no live response to questions in Q&A. That is once again the policy of this board, always has been, and any other board that I've served on and any other that I'm aware of, there is no time in a regular board meeting to answer questions live from the audience. With that, Commissioner Trieger.
Thank you, Chair. Thank you for the presentation and Happy New Year, Mr. Adams, Dr. Warren. I have a brief question. I'm mindful of the time, but I know the new walk-in clinic for boosters and prime doses was well received by the public, and there were some long wait times. And so I'm wondering if you could just please give us and the public an update on the availability of vaccine, including boost doses, both at that center, what's going on at the Lane County Fairgrounds, and what the pipeline of boost doses and prime and secondary doses are in private physicians' offices, pharmacies, and so on. Just talk a little bit about the pipeline and availability.
Okay. Chair Farr, Vice Chair Trieger, thank you for the question. Indeed, today being Tuesday the 4th, the walk-in facility that OHA is reopening again after a long weekend off for the new year. That is operating from 12 to 7 at the Riverbend Annex on International Way in Springfield, Tuesdays through Saturdays, and then 12 to 4 on Sundays. So that is fully operational. At the Florence Events Center, we have a second OHA-run facility that has just opened. I'm told they opened on 12/31, took the weekend off, and is now operational this week. But they are accepting walk-ins currently at FEC now for boost doses. So that site is operational, and we have confirmed that FEMA will be deploying a bus in Cottage Grove at Bohemia for the second 2 weeks of January. Is the estimated time frame. They will be providing both tests as well as vaccinations at Bohemia Park. And we'll have more detailed information on our website about that operation. And of course, we continue to operate at the Lane Events Center and will do so through at least the end of this month in providing doses. So we had really kind of carved out about 18,000 boost dose capacity a day. That was the calculation before I left for holiday. And we've since the team continued while I was out and really secured additional capacity. I think we're probably more than that now. I don't know what the number is. However, Vice Chair Trieger, and I'd be delighted to get back to you with that specifically.
Thank you. And are those all ages?
Chair Farr, Vice Chair Trieger, that is correct. So we're providing vaccinations for individuals 5 and up for the Pfizer vaccine, and then boost doses for all of those approved. And that number continues to drop. FDA just indicated yesterday that they were going to approve 12 plus for boost doses. And Chair Farr, if I may, just coming back to Commissioner Buck's question, we currently are reporting 576 staffed non-ICU beds in Region 3. And 529 of those are occupied, so 47 are empty or available. We're also reporting 91 adult ICU beds in total for all of Region 3. And we currently have 14 of those available.
Thank you, Mr. Adams. Commissioner Trieger, does that exhaust your questions? I'm sorry, Commissioner Trieger, I did not hear that.
Yes, thank you, Chair.
Thank you so much. Then Commissioner Burney, I see that your hand is raised. Is that an echo or is that actually raised?
It's both. I just noticed this raised hand feature on this new format, so I figured rather than yell, I just raised the hand. First of all, thank you for all this work. Everyone that predicts, in my brief life experience, is wrong. The predictions are wrong, right? Economists will predict what the economy is going to look like. Different groups will predict. So my sense is, and I'm going to give a personal example and then get to the policy question. My first wife, who was supposed to outlive me, passed away 19 years ago from non-Hodgkin's leukemia. I was given by all doctors at the time, based upon then the knowledge, right, a 0% chance to live past 30, having contracted juvenile diabetes at the age of 9. There was no way to manage or monitor that condition at the time. Now I have an app on my phone that tells me my blood sugar level at every 5-minute intervals. We know more. Predictions tend to be wrong, but they do tend to lead us into greater knowledge, right? So that we can, as Dr. Warren was explaining, we can develop tools and a knowledge base to deal with things. So given that, of course, OHA and other predictions are going to be wrong. The data is going to be questionable. That's always going to be the case. I question it too. We can always poke holes, and we should. But the reason I mentioned personal examples is because we tend to look at, oh, what's the management capacity of hospitals, right? It's policy, it's aggregate. It's not looking at the human experience and the experience of families dealing with either health, which is joyful, or discomfort and dis-ease, which is not. So my question is this, very non-scientific. It looks to me like this thing is going to spread like wildfire, forgive my lay terms. And the hospitalizations won't be as significant a percent of the total affected population. It looks like we're developing therapies to even mitigate that. Now, what I've read, and I don't know if this is true, I'm asking you, is that not the getting of the condition, the Omicron variant or Omicron or whatever else it's called, but the hospitalizations that are occurring as a result. Is it correct or not that this is primarily occurring with those that have not yet received either vaccinations or boosters, or is that not correct?
Well, Chair Farr, Commissioner Berney, so indeed, the projections are helpful in that they provide planning scenarios for us, right? As we try to anticipate what we need to do to shift resources, how we need to communicate to the public, how we can work with hospitals to try to think about capacity gaps and the rest, and just continue to try to meet the demand for boost doses. We are seeing, we continue to learn. We're 5 weeks out from learning that Omicron is a thing. It really has happened that fast. I think your observation is spot on that this thing is like wildfire. There is a wave coming to us, and we are telling people and have been telling people here in Wayne County that there is a wave approaching and be prepared. And the best way you can prepare yourself is to get vaccinated. If you're not vaccinated, get boosted if you're not boosted. But regardless, right across the board, use the the common sense non-pharmaceutical interventions that we all know. This is the safest thing that you can do to prepare yourself. So with respect to how we're still learning about disease, so it does look like the Omicron is those individuals who have prior infection may have some protection against severe disease based on this. So there's different kinds of immunity. Dr. Pat will really be able to give you a much fuller briefing on this, but we're starting to see some science that suggests that we might get some protection. We've been worried about that. But certainly the most durable defense against this thing is being fully vaccinated and boosted.
And if I may, is it conceivable that there's a scenario where this spreads to so much of the population, vaccinated or not, and that vaccinations might mitigate symptoms? That this might be a blessing in disguise and might actually generate a herd immunity in this area and in this country, or is that just wild-eyed speculation?
Chair Farr, Commissioner Berney, I think that is I think that's not knowable at this time. I think it's possible that could be an outcome. This thing is we're going to see a bunch of cases here, more than we've seen out of any variant so far. I think I'm comfortable telling you that that's very, very likely to happen. What happens with further variants down the road, who knows? But yes, we will see a lot of additional immunizing antibodies generated from this wave.
Thank you. And finally, and thank you, Chair, I'm sorry to belabor this. Finally, there have been comments made, and I just want to clarify, either Mr. Mokryhiski or yourself. We as a county board of public health have not created any of the mandates that either the state or the federal government has created outside of county employees. I mean, we've not closed facilities. We've not, taken positions in that regard. We've even intentionally said we were not going to enforce, because we don't have the resources, some of the policies that have come from the state and the federal government. Is that correct? Or is that what we're doing is we're creating an option for people that want to get vaccinated, and we're giving them our best education as to what the prudent course of action is. Is that correct, or is that not correct?
Chair
Yes.
Farr, that is correct.
Right. Yeah, and I just, sorry, Steve. I just was going to add to that we have, as a responsible employer, taken steps to make sure that our employees and the public, that the health and safety of our employees and the public when they're conducting county business is met. But we have not imposed any requirements related to masking or vaccination or any other matters on the general public in our community.
Thank you, Chair.
Thank you, Commissioner Burney. I see no further hands raised at this point in time. Any commissioners wish to ask further questions or make statements? Then I'll bring us to a close. Dr. Warren and Mr. Adams, thank you for the presentation. My only comment is just a takeoff from the quotes that I've heard throughout this presentation, throughout what you've stated, and that as we are the Board of Health, we 5 commissioners are the Board of Health, and we are a part of the front line of defense in conveying the messages, conveying accurate information, and presenting scientific research as we trust it and as we understand it as it's presented to us. But Mr. Adams and Dr. Warren, I'm going to say this: if people ask.
Chair, you're frozen and we can't hear you. I'm communicating with our chair through the wall here at the office, letting him know he's frozen.
Well, as vice chair, you bang on the wall and then you take over the meeting.
Am I back now? My screen froze moments early there. Oh man, I was so eloquent. You should have heard it. It was amazing.
That's what they all say.
People at my window are cheering and clapping. Thank you. Thank you. So the only thing I just bringing this to a close with just a personal response. As the Board of Health, we are the Board of Health. What I'll say to people is, as the wave approaches, the best thing that we can do individually is non-pharmaceutical responses such as regular hand washing, such as a well-fitted appropriate mask, and that the best line of defense is full vaccination. And that, if people ask me what to do, that is a response I'll make unless you correct me at this point in time, Mr. Adams or Dr. Warren. I see no correction on that. Any further questions or any further items from staff? Mr. Adams, Dr. Warren, Mr. Mokrasky, thank you very much. We will, at this point, we will recess the joint meeting of the Board of Health and Board of County Commissioners and reconvene the meeting of the Board of County Commissioners. Moving along with the next item on our agenda is the consent calendar. We have a number of items today on the consent calendar. If you're watching or following online, you'll notice on the Board of County Commissioners agenda, there is a view material key, which you can click on and get the full agenda item from the consent calendar. Once again, it's a lengthy consent calendar. Nothing has been pulled. This will all be considered as a single item with a single vote. Do I have a motion?
Chair, I'll move that we pass the consent calendar for January 4th, 2022.
I'll second.
Moved by Vice Chair Trieger, seconded by Commissioner Buck, the consent calendar for January 4th, 2022. Any discussion to the motion? Seeing none, I will call for the vote. All those in favor, please say aye.
Aye.
Opposed? None. Passes unanimously. Thank you very much, and thank you for this remarkable consent. And if you've not looked at it, there are some pretty momentous items on there that we just passed by our consent. We'll move along to item 7A on our agenda, which is order 22-01-04-27, in the matter of approving one contract amendment with St. Vincent de Paul and delegating authority to the county administrator to sign the amendment. Before I call on the county administrator, Commissioner Buck.
Thank you, Chair. I'm going to have a conflict of interest on this particular item. I am related to the director of St. Vincent de Paul, and they are party to this particular agenda piece. So I'm going to turn off my video and mute myself for this.
Thank you for that declaration, Commissioner Buck. We'll move forward with the agenda with 4 commissioners present. And Ms. Smoker-Heiske, I'll pass it directly to Ms. Gaffney, Director of our Health and Human Services Department. Ms. Gaffney.
Thank you, Chair Farr, and I will be brief this morning. This item is actually a companion piece to a number of amendments that were passed as part of the consent calendar as well. We have received additional funding for our rental relief, rental assistance program, and this particular amendment is to contract with St. Vincent de Paul as one of several partners in the community to help us make those dollars available to members of the community who qualify and need that service. So that's the amendment in front of you today.
Thank you, Ms. Gaffney. I see no hands raised with questions. Commissioners, I'll call for questions or comments. Seeing and hearing none, I'll call for the vote. We have before us Order 22-01-04-27. Do I have a motion?
So moved.
Second.
Moved by Commissioner Trieger, seconded by moved by Vice Chair Trieger, seconded by Commissioner Burney. Order 22-01-04-27. All those in favor, please say aye.
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 Any opposed? None. Passes 4-0 with Commissioner Buck excused, absent, recused. Moving along then, we'll move along to item 7B and give Commissioner Buck a moment to rejoin us.
She's here.
Very good. Thank you. And item 7B is a discussion on the Behavioral Health Crisis Center. Today we have with us Mr. Smoker-Heiske, we have Ms. Gaffney, Dr. Gachohi, our Lane County Behavioral Health Division Manager, Shauna Mart, Jeremy Jalabert, and Jamie Sellar, as well as Carlos McCall. Ms. Smoker-Heiske, I'll move directly to Ms. Gaffney and have Ms. Gaffney introduce the item and introduce any appropriate staff. Ms. Gaffney.
Thank you so much, Chair Farr and Commissioners. And actually, I am going to keep my thoughts very brief because the exciting part is for you to receive the update on our Behavioral Health Crisis Center. And Pauline, Dr. Chiohi, as our division manager, has assembled a great team today for you, both consultants and our internal team that's been working on moving this project forward. And as you know, it's a priority of the board and critically important to our community. So we are excited to provide the update, and I'll actually let Pauline introduce the team, and I'll stay here to help answer any questions that may come up. Pauline?
Thank you, Chair and Board of Commissioners. It's an honor and privilege to be here this morning. And aside from the people that have just been mentioned, I want to acknowledge the many other people that are involved in this project. We have a ton of stakeholders who are very passionate and have been very committed from the very beginning. So I want to acknowledge all those people who couldn't be here this morning. So the 5 of us this morning just have the honor to have to present that collective, passionate, and commitment from the larger community. So we have the Lane County Behavioral Health staff. I'm gonna quickly just introduce everybody for the sake of time. So it's Shauna Matt, who is a program manager for one of our programs in behavioral health. Jeremy Jerabat is our senior management analyst, so does a lot of the data collection and have been very critical in coordinating with our RI international consultants. So for the part of the consultants, Jamie Sella is here with us. He's a chief strategy with RI International, and Carlos McCall is the vice president with that body. And again, they are only 2 of many others that are also consulting on behalf of this project. So for a quick recap, Jeremy, next slide. I was here, I think almost 2 years ago, and did a comprehensive overview of our crisis crisis center overhaul, or actually crisis response, looking at the entire crisis response. And the crisis center is just a piece of that continuum. So today we're just going to be focusing on the crisis center, but keep in mind, this is one of the pieces of the comprehensive crisis response. So far, what we have done is, of course, consulted or contracted with our consultants, and I've been working with them on just kind of what the need is for Lane County. So just a quick recap of the consultant work. This is a group that is that are national experts when it comes to crisis centers in the country and internationally. So they have done a lot of this work. They have put up a lot of crisis centers in the country as well. So we are fortunate to have experts who have actually done this work and who have been successful in putting forth a lot of structures and a lot of facilities across the country. So we've been working with them, just looking at what the community needs in terms of looking what is already in the community, what the gaps are in conjunction with some of the work that we had done before. And as a part of that, also working with OHA, there have been a few grant applications that we have put forth, hoping that we will get additional monies to help us in this endeavor. And I would be remiss if I didn't mention that the county and the county commissioners have also set aside $7 million that was just approved a few weeks ago, I believe, towards this endeavor. And we've also applied for another grant through the state. It's through Misha 110. Most people refer to this as the marijuana money. Again, looking at ways that we could get this funded. Next slide. So what we continue to do is meet with stakeholders. I mentioned there's a group of a lot of stakeholders involved, and a big part of that group is the Mental Health Summit that brings together representatives from law enforcement, the cities, the courts, all behavioral health providers, and just making sure that we are looking at all the gaps in our system. And we continue to work with RI on capacity and financial modeling, looking into other additional gaps that we may not have seen or may have not anticipated before. Just a quick review that, in the last 2 years, we've really learned a lot, through COVID and the needs in our community, especially around behavioral health. So we are keeping in mind new things that are coming in. So one of the things you're going to notice in our presentation is that we have added a section of a youth crisis, which was not part of the presentation that I did before. Just something that really hit us during the pandemic, that there is a big crisis also with the youth, and we also need to pay attention to that as we are creating this crisis response. So next steps will be looking at potentially a site, and that will also determine how quickly we can get this work done. And with that, I want to invite our consultants, Jamie and Carlos, to walk us through what they have done since we partnered with them, and also get into the actual recommendations and next steps. So Carlos?
I think I may go ahead and jump in for the first slide here. So first off, on behalf of the entire RI International team supporting Lane County, we'd like to thank the Board of Commissioners for the opportunity to talk about the work that we're doing on this exciting project. As was mentioned previously, really what we're doing is supporting the creation of a crisis facility that's going to serve all of the people in Lane County. And to begin that, we start with capacity modeling. So RI International has capacity modeling algorithms that we've created in conjunction with the National Association of State Mental Health Program Directors, which is the professional trade association for the behavioral health commissioners of all U.S. states, as well as territories, also endorsed by the National Action Alliance for Suicide Prevention. And really what we do is we take data currently from Lane County, we start to model that up against predictive modeling algorithms, utilizing current data that we have. And in areas where we don't have current data, because maybe the services have not been provided yet, we start to supplant that with national best standards, rates, and what exemplars are starting to get. Really what we've done is to create this algorithm, we've used 1.4 million data sets from the state of Georgia that really kind of starts to stratify what type of crisis people go into and what kind of care most suits the needs for those folks that are in crisis. So based on utilizing that algorithm with the data that we've worked diligently with Lane County to support, and as well as some discussion around what options we might utilize for data that is not currently available, we've kind of determined that about the size of the facility should be able to serve 42 people at a time. We anticipate that to be about 30 adults, 12 children and youth. And we think that the annual impact is going to be about 1,500 youth and about 6,700 adults. And this would be unique individuals that would be served within the community. So we'll move to the next slide and I'll let Carlos introduce himself quickly.
Sure. Hello, everyone. I'm Carlos Mackel, Vice President of Strategy at RI International. And just like Jamie said, we're very happy to be here and support with the efforts to roll out these crisis services. So as we look at the actual impact that this crisis system is going to make in the area, we look at a couple of different factors. Most importantly, it's going to be the actual in relationships that we'll have with the providers who are already there existing, providing those services, making sure that the referral pathways are there and seamless. So with this 24-hour crisis facility system that you guys are going to have, which is the Crisis Now model adapted by SAMHSA, proven to be, which is the most beneficial right now for individuals experiencing crisis, is very robust. It's very, very different and unique compared to a lot of the crisis systems that you probably have had in the past or have heard of, where it's more like a walk-in clinic style, not 24 hours, not admitting everyone, not always accepting your most violent and aggressive individuals. Whereas though this particular system will be that. It will be the system that will be a no wrong door, meaning that we accept everyone with the exception of them having 2 acute medical issues, which obviously if someone walks into our doors with a bullet wound, we won't be able to service them with a clinician and a nurse. So with that in mind, we're accepting everyone. And it's really, when you think of it, it's bringing a lot of different benefits to your community when you focus on taking a lot of the alleviation, taking a lot of the pressure off of your emergency departments, who obviously are dealing with a lot of COVID issues as well right now. But just that mental health aspect, that behavioral health aspect, in addition to that substance use, overloading your EDs, that problem won't exist as much, and hopefully not at all. You're going to be looking at a lot of cost savings. It's a big diversion piece when you look at really implementing these crisis systems, because what happens is a lot of the issues that individuals experiencing actually get dealt with, opposed to being passed off to someone else. So just looking at real quick, emergency rooms, law enforcement, your cost savings, and just best practice. So your no wrong door is really going to be great for your system. Next slide, please. Okay, so with this piece, we started to talk about our recommendations for facility size. And just like Jamie said, we use our crisis calculator to get a lot of that insight. And if you look at this piece here, you can see where we broke it down for really important parking spaces, making sure that we have ample spacing for law enforcement when they pull up, ambulance and that type of thing, as well as having adequate square footage for your youth facility. Anytime you have adults and youth, you always want to make sure that you have ample dividing space to make sure that it's safe treatment and quality of care is being present. And then you also want to look at, Jamie, is there anything you want to touch on with this piece?
Certainly can. What kind of informs square footage is a couple of things. One is going to be state regulations. There's going to be regulations around these types of facilities, and you need to ensure that you're going to be able to meet standards that are going to be able to allow this facility to be licensed for both adults and for youth. But secondarily, as a provider, I know we're a consultant currently with Lane County on this particular process, but we do have provider experience in 10 US states. Really what we know is we think these square footage is going to make a facility that's going to be conducive, it's going to be safe, it's going to encourage security, but it's also going to be something that does help people resolve their crisis in a way that's going to be compassionate and less stressful for them. So basically all that 30 years of experience coupled with the regulations in the state of Oregon has gotten us to, this is what we think would be the best facility for your community.
Absolutely. Next slide, please. Okay, so we started to look at this piece, and we know that initially there was an estimate of what you guys anticipated on what this would actually cost. But in all actuality, once the crisis calculator was put in place in your area, we actually identified, with an addition of adding the units for children, this is where we landed at. And it's actually being as though we do this, and as Pauline spoke about, Jamie and I, we're pretty much doing this across the country. And I was sharing with your team that they're doing a really good job at being great stewards at the funds that they have right now, because this number is kind of falling right in, right on the low end. So they've been really mindful of the cost. And this can be affected obviously over time. The supply chains is being affected every day. And then also it was an increase based upon the impacts of COVID. And we're still trying to project that. A lot of different things when you're looking at different types of things that we're having to put in our facilities to keep the air clean, to keep staff clean, and what have you. Next slide, please. Okay, so here's more of a breakdown. Now, what's important to understand with this slide is this is talking about your total system. So this is if we capture everybody is served who's in crisis, this is what you'll be looking at. And this is what's most beneficial. And this is the reason why the country has really leaned towards our crisis now model. And a lot of the cities and counties have adopted this as well. Because when you look at the savings that you're gonna have from your emergency departments, the savings that you'll have from your law enforcement, which is they call wall time. A lot of times your law enforcement are sitting in your emergency departments for hours, or out in the communities dealing with individuals for hours. Then you also need to factor in your diversions from higher levels of care. With this model, really focuses on the engagement and the diversion piece, where we've shared some data from one of our states with your team, where we're diverting 60 to 70% of individuals from a higher level of care to where they need to be, whether that's an outpatient program or back to their organic supports or to their ACT team or whatever. So putting this type of system in place is gonna give you guys a cost savings in a lot of different areas. But once again, this number is based upon us capturing everybody in your area who's experiencing crisis. Jamie, you want to add to that?
Yeah, absolutely. Thank you, Carla. So really, just to not put a fine point on this, this is going to be system savings. This is not just necessarily going to be savings to Lane County. Really what we look at in traditional behavioral health, and we see this across the country, is there's two levels of care. I've got traditional outpatient, and then I've got the more traditional inpatient care. If we take a look at Lane County, we do know, based on the data that we've collected, it's about an average length of stay of 9.5 days in an inpatient facility. So if we start taking a look at the cost per day times that 9.5, you start getting an episode of care cost, which we're estimating at about $14,000 every time someone hits into the facility. Now, those costs are shared among the commercial insurance plans, the county, Medicaid, TRICARE, a host of places are covering those costs. When we start to put people into the level of care that best approximates what their needs are, we tend to go ahead and be able to provide lower lengths of stay, lower costs, better value, and really getting what we would call clinical care fit to need. So instead of someone who's just no longer appropriate for an outpatient level of care getting put into an inpatient level of care at a higher cost, they're getting into a course of treatment that's going to best match their needs. So when we look at that annual savings, that's not just for the county. That's going to be savings to Medicaid. That's going to be savings to commercial plans, to the emergency departments who are going to be able to divert people either initially without being seen in an emergency department, or they're going to be able to quickly transfer that person over to the facility that we're talking about. So I just want to make sure that that $54 million is not what we're saying the county is going to go ahead and save. We're saying that's the system costs across all levels of care for the entire community.
Yes, sir. And then before we go to the next slide, just would like to just add into it, because I wanted to spend a little bit of time breaking down the staffing model for these facilities. So these facilities, for example, our crisis facilities are staffed with 24-hour provider coverage. And that's 24-hour nurse practitioner or psychiatrist. That is 24-hour master level clinician, 24-hour registered nurse. And what's unique about our program, which I really appreciate, is that we are peer first, peer last. And I was listening to Commissioner Joe when he was talking about how important it is to really touch upon, what's best practice and what's the human aspect of it. And that's what's really good about what we do with this crisis now model, is that it's really serving everyone. It's really no force first. It's really most inclusive. It's the least restrictive. And then it's really following that, hey, we're going to get you to where you need to go, and not really trying to tap into how much we can build. And that's what ends up happening when these systems aren't in place in communities and people go to private hospitals. They're actually held there, and a lot of times they're held at for long lengths of time when they really don't need to be. So we're trying to really try to keep the field balanced by making sure that the proper systems are in place to get people where they need to be. And that reason, and the reasoning behind that robust staff is to make sure that we can try to stabilize individuals to the best of our ability within that time frame and get them back home.
And we might be able to go, I think, 2 slides, because we kind of are combining some of the data on this. So we might go to the operations slide next. Forward twice.
Yep.
So ultimately what we've done is we've been able to take a look. So what we do is we start to focus on what the capacity is, what the need is, and what the utilization is. We then start doing some fairly simple mathematics to go ahead and determine what the revenue may be from all funding sources. And that's going to go ahead and include the commercial plans. It's going to include Medicaid. That's going to include what the county's going ahead and supporting for potential indigent care for folks that are uninsured or uninsurable. And then what we also do based on our years as a provider is we're able to actually talk based on staffing models that we create. What do we think the actual operating expenses are going to be? For us, what we would not want to do is give recommendations for Lane County of a facility that would be unsustainable financially. What we do in the Crisis Now model and through SAMHSA's national guidelines is lean heavily on Medicaid to go ahead and support and be sustainable. So the first thing that we start to do after we come up with our capacity calculations is determine, does this pencil out? And in this case, you see the numbers up there. We do anticipate that it would pencil out. Next slide, please. Just a little bit about the math that goes into that. In expansion states across the country, what we do see is about 70% of folks that are in crisis facilities, as well as seeing crisis mobile outreach teams, generally going to be covered under Medicaid. Now, the penetration rates for Medicaid may be much lower, but when people go into crisis, inevitably, there's a higher percentage of them that are covered under Medicaid. And then what we do anticipate is there's a combination. It's usually about 5% Medicare, usually about 20% commercial, maybe 5% underinsured, that combine to make that 30% folks that are going to be non-Medicaid. They're going to be reimbursed at various levels, depending. And we go ahead and put that into our calculations as well. We've reflected current Oregon reimbursement rates. And what I will say is I do anticipate those rates may change. RI International is also the consultant for the OHA. and how they're looking at the crisis system as a whole from the state level, especially with 988 implementation. And part of the recommendations is to go ahead and be able to align what the reimbursement rates are for Medicaid with what the real world costs for providing these services in a high cadence, no wrong door approach. And then the potential cost savings to the crisis system overall as a whole. And once again, those crisis savings go into emergency departments, they go into commercial plans, Medicaid plans, the county. It does get spread across the entire continuity of care. Next slide, please. And this is, the project timeline, and maybe some folks in Lane County may want to talk about this a little bit more as well. What we do know is there's long lead times when you are looking at facility development, finding a facility, getting the architecture, currently in a COVID situation of getting your subcontractors and contractors up and running, getting the licensure requirements, getting the permitting. All of these things do take time. So what you're looking here is what we think is a projected timeline that certainly could be completed. Yeah, any time for Q&A.
Thank you for the presentation, Ms. Gaffney. Anything further from Lane County staff?
I think I would, again, leave the bulk of the time for response to Commissioner comments, Chair Farr. I would only say that just to complete the circle, there's huge investment from our community partners in this project as well. So I know that Pauline mentioned that in the beginning. The community sees the need for this, appreciates the county's leadership in bringing people together to make this happen, and I think is prepared to partner with us in moving this forward. And I know that project timeline is a little daunting for many of us who wish that we could have the center open more quickly. And I would say that I think the biggest variable for us is settling on a location and a site. And once we're clear on that, a lot of those other timelines can start to move. So with that, Chair Farr, I'll turn it back over to you.
Thank you, Ms. Gaffney. This is a wonderful presentation, and it's great to see such a robust national effort. I've also been looking online. There's a very robust online presence for Crisis Now. So with this, commissioners, I'll have some questions later, but I can see all your faces, and I'm looking for raised hands with questions and comments. Then I see no raised hands. Commissioner Buck, followed by Vice Chair Trieger.
Thank you, Chair. Just waiting for other people to start first. I'm really excited about this. Our community has needed this for quite some time, and I appreciate how far we've gotten. It sounds like we haven't quite figured out the full way, the full path to financing the construction and the ongoing operation yet. I'll be really interested in the next update. Hopefully we'll get more of that financial information. This is a pretty big project for us in Lane County. Ms. Gaffney, do you know how often we'll be provided some updates on how it's going?
Chair Farr and Commissioner Buck, I think our staff would be happy to provide those at whatever cadence the board is interested in hearing from us. So, either today or certainly regularly through agenda setting. If you let us know how quickly you want those, we can schedule them, and we certainly would plan to come back when we hit milestones. I don't know, Pauline, if you have anything you want to add to that.
Yeah, that's accurate. We are happy to provide updates as needed.
I'll just follow up with the financials. You had mentioned that we have a lot of community partners that are really interested in this. I'm wondering if we know if they're willing to also commit some funding for this project.
Pauline, do you want to start that one?
So far there is commitment. I know we've had conversations with the two CCOs in our region, and while they haven't necessarily said this is how much we're going to be committing, I think if it comes time to it, they would. But of all the stakeholders involved, there hasn't been that level of commitment in terms of finances, and Karen might know more about that.
Yeah, I would add the presentation that talked about the heavy reliance on Medicaid has been our assumption from the beginning, that when this is successful, the benefit and offsets are felt by Medicaid as well. So I think the CCOs are both prepared to share that cost savings and make those investments in this effort. And I know we've had conversations with Peace Health, and Todd Salness there comes from a system that had a robust crisis center, and he's very excited about the establishment of one here. And so I think those partners understand that it will be a community-wide lift to make it happen. But yes, we haven't asked for the financial commitments yet until we're more clear on exactly what the budget looks like.
Thank you. Commissioner Buck, does that exhaust your questions and response? Thank you. I'm looking for additional raised hands. Vice Chair Krieger, followed by Commissioner Bozovic.
Thank you, Chair. First, just thank you for this presentation. And I am also, I'll just echo, my colleagues very excited to see this work moving forward. And as for when and how frequently we need updates, I would say whenever there's new information, I think all of us want to stay current on all the developments on this project. Lots of questions and comments that I will save as we get those updates and they become more relevant, but I have two for today. One is the application to OHA for a planning grant. If we know the timeline of when we anticipate we'll hear on that, because that seems an important next step. And if that application, if that grant will fully resource the planning effort, and if not, what the gap is for that stage of the project. That's my first question.
Sure. So we did. So what OHA did was, so this is money that investments that was set aside through the last registration. So there is $80 million that was set aside for any new investments in behavioral health. And what OHA did, they started with proposals for what communities are anticipating is their needs in the various communities and the counties. So we got $50,000 awarded to us as part of that planning. So we used that, or are using that for FTE as we plan to see what this project looks like. And then the proposal was going to be then opening up avenues for the larger amount. We don't know the timeline. The last I heard, there was going to be OHA was going to convene most of the people that were awarded the proposal grant to come back again and have a proposal to the legislatures on how the $80 million is going to be invested. So that is yet to be revealed from the OHA. So I don't have a timeline yet, but we are hopeful that we'll get a sizable amount from that $80 million. How big, we don't know.
Great, thank you. My other, it's a comment as much as a question, but I would love to hear any feedback you have, is I noticed on that timeline in 2023, a pin in the issue of workforce development and training. And of course, that's something that's popping up in every sector and every industry, but particularly here. And Ms. Gishoia and I have had conversations about this, that I've talked with other community partners and local electeds about the need for workforce development and training for mental health and behavioral crisis workers at a wage that justifies them going through the education, training, certification that makes them want to stay in this community and do that work here. We have educational institutions here that are training folks who then leave our community to apply their learning because we can't offer positions that are attractive enough to find them jobs and retain them. So I'm wondering if there's anything for this board at this stage that you'd like us to know, or things that we could be thinking about to create the right glide path. So when you hit that point in your timeline next year, we are more ready to progress faster on workforce development and training for this project. Thank you. That's all of my questions, Chair.
Thank you, Vice Chair Trieger, and thank you for the responses, Dr. Gitrohi. Commissioner Bozievich, followed, I believe, by Commissioner Burney. Thank you.
Thank you, Chair Farr. I just want to say how much I support this project moving forward. I had some questions about the financials and all, but you answered most of them through the presentation. So no real questions there. Just want to note that this was something that we visualized quite a long time ago here in Lane County. We've had a real commitment to trying to resolve some of these behavioral health issues. We instigated the FUSE pilot, the frequent user system engagement here in Lane County. Our sheriff at the time recognized that our jail was our largest behavioral health provider in the county. So one of the things we did in our contracting for medical services with the jail was we added behavioral health staff in our medical staff for the jail. We've made a lot of changes in our jail to make it a better environment for people, having behavioral health issues, but we all know it's never been where they should go. And we all understood that. So we invested and set up a 24-hour respite with the Hourglass Clinic and funded that in Lane County. And we also moved forward with a Housing First initiative based on that frequent user system engagement with the MLK Commons project. This is just a continuation of that effort to divert people from these high costs. We understood from that project that MLK Commons would save us money, and the percentage of savings is almost exactly duplicates what you're projecting for this crisis center. The total cost minus the cost to the various systems, if we didn't have it, versus the cost of running the actual, system, the crisis center. We saw that same projection from our FUSE pilot for the MLK Commons project, that we're going to have that kind of cost savings. So I just can't say how much I support us continuing to move forward on this, and I hope we can gain the capital funding we need to move it ahead. And I hope our projections for the revenues through the Medicaid system are accurate, so we get up and running. It's something we've been talking about for so long here in Lane County. I'm just so looking forward to this. So I just want to thank the team and our staff, the consultants, and everyone involved. It's something that, Chair Farr is shaking his head. He remembers all this, years back too, as we started talking about these things. And I'm sure that Ms. Gaffney, as you're looking towards your retirement, remembers the initiation of the FUSE project and all these discussions and these little, pieces we've slowly been putting in place to try and make things better here in Lane County for those with, in mental health crisis. And I think this is just a huge step moving forward. So thank you very much.
Spot on comments, Commissioner Bozievich. Commissioner Burney.
First, I also support this and enthusiastic and glad we're not moving slow anymore. When you build a foundation, it takes a lot longer. So that's in no way demeaning at all of the pace and the work done to date. What does RI stand for?
RI stands for Recovery Innovations. Probably about 8 years ago, we started working in New Zealand. So then we became Recovery Innovations International, and that just became RI International. Too much of a mouthful.
New Zealand's a good place to go for recovery, I understand.
It is.
So I think you would agree that mental health and substance abuse crisis is a good business to be in right now, correct?
Yeah, it's unprecedented. We're in the midst of change that I did not anticipate I would see over the course of my career.
Right.
Right now, we're in a stage that I would equate to being more significant even than Medicaid expansion. With the funding that's coming in, with the advent of 988, with really the integration that we're seeing, it's absolutely an exciting time. I don't anticipate I'm going to get a day off until at least 2023, just because we're on the front lines of significant change that I probably won't see again in my career.
If I may, because I have no words of wisdom, I'm delighted. I think we need to get moving. I think that the further away projections are, the less likely it's going to look exactly like that, especially when you talk about construction, labor shortages. I read an article this morning. More people are now retiring and more jobs are going unfilled than ever before. And yet concurrently, I'd like to try and suggest an additional line for your company, because I think you're exceedingly well positioned, and it relates to comments Commissioner Trieger made, and that is the notion of workforce. I'm going to suggest you all look at apprenticeships modified as a way to exponentially, in very little time, bring people online, pay them, and train them for jobs that actually exist, as opposed to jobs that we're anticipating will exist, but we don't know. I think that, not that you want to take me up on it, but I would be delighted to chat with you about that. I think it's one of the few ways you can get immediate support for quantitative workforce impacts in a field that's responding to these crises that we're seeing, and that your company is attempting, right, to support our communities respond to in a compassionate, pragmatic, common sense way. That's my only comment. Thank you very much.
Absolutely. And workforce development is something that, you're right, it absolutely is a stress. You can create a beautiful system, but you got to get folks willing to work in a high pressure environment to go ahead and meet the goals of the community. It's tough to do sometimes.
One of the things that I've heard nonprofits now for a few years that I've been a commissioner complain about is the wages they are paying people that now maybe compete with McDonald's entry wages in this work. So I think Commissioner Trieger is spot on in terms of adequate reimbursement. I think, if I may, Chair, we're also in a period where we're rethinking work, and we're rethinking wages, and we're rethinking priorities. So that, for me, the notion of apprentice, really all that means is enabling real-time connection between those that need work and those that are working. That's all. So forgive me for the time, Chair. Thank you.
Time well taken, Commissioner Burney. Spot on with the workforce comments. And I'm not going to belabor the workforce issues, other than to say that the director of our largest crisis center, our largest behavioral health facility in Lane County, is in the audience right now. He's not on the panel, and he will echo the fact that we have difficulty filling those positions. That director, by the way, Sheriff Harold, who is the chief operator of our jail, which is our largest behavioral health center in Lane County. As we move forward, we're looking to change that. We're looking to we look at the $54 million in savings. No small part of that is going to come through the sheriff's operation, which will allow them to be more responsive to criminal activity in our community. But the only thing that I'm going to say, and once again, this is a spot on. We're all using the word spot on right now. A fantastic presentation. Exciting to know that you've done such deep research into it, that our eye is on the job and given us the benefit of their work and their ongoing practices. Dr. Gishohi, I'm going to mention that the day that I met you was before you came to work for Lane County, and it was at our mental health summit, our monthly mental health summit. Now, to you, Mr. McCall, Mr. Seller, and Mr. Jalabert, if I'm misusing your titles, by the way, if any of you are a doctor, just raise your hand right now. But that being said, we have a mental health summit here in Lane County that has really been studying this for a long time, as far back as I can remember as a county commissioner. And Pauline, you were with us on the mental health summit before you came to work for us. I hope it attracted you to Lane County as a potential place to work, because it really is a convening of judges, of municipal police chiefs, of the sheriff, of professionals, of psychiatrists, who really have been talking about the direction we're excitingly moving in right now. There's a lot to be said about it. I'm not going to continue this discussion, but I'm so very excited about where we are at this point in time and so highly anticipatory of the work that is yet to come. The horizon is beginning to clear up. So thank you very much for this amazing presentation. If nobody's gone online to look at the Crisis Now model, there's a lot of information on Crisis Now model, including a number of videos that actually show it in practice. So thank you very much to the participants in this panel discussion. Ms. Gaffney, I'll hand it back to you for any further staff or panelist comments.
No, I'm looking at Pauline to see if she has any final thoughts, anything you want to conclude with, Pauline?
No, I would like to extend my appreciation on behalf of the presenters today and on behalf of the community that we're grateful for your support. So we really appreciate that, and we'll be sharing more updates as they become available. So we'll communicate when we have major updates with the board. So we thank you for your commitment to this work, and thank you for having us today.
I think it's safe to say you're seeing and hearing 100% commitment. And I'm going to throw out an invitation to anyone listening, including elected officials and anyone on this panel. Tour our jail. In the last few weeks, I've toured the jail 4 times with different groups, including with Commissioner Trieger at one time, with elected officials, with professionals in the community, and with business people. It is an eye-opening inside view of how our criminal justice system intersects with behavioral health and ways that we can avoid that sometimes very harmful and clashful intersection. Once again, thank you to the panel today, and we'll move along to our next agenda item. Thank you.
Thank you.
Then coming up is a county council. Mr. Dingle, we have before us order 22-01-04-23 in the matter of notifying board members of emergency meetings and board participation in emergency meetings. Mr. Dingle, I'll turn it directly to you.
Thank you, Chair Farr. These are the, I think everyone now that is currently on the board has been through this. This item and the one that follows are ones that are part of a package that are adopted and reconsidered by the board every January to see if there's any desire to change them. The first one that you've mentioned is the notification of board members and when we have emergencies and how they participate. So again, it's just, this is part of our resiliency and preparing for emergencies so that the board can act quickly. And that's all I really have unless the board has a specific question.
Thank you, Mr. Dingle. I will open this to questions from the board. And I see no hands raised, Mr. Dingle. Thank you for the presentation. And we will move along with the next agenda item, which is item 8B. Excuse me. We'll go back to 8A, Mr. Dingle. Do you have any announcements?
I do actually have an announcement. I am able now to tell the board that over the last, I don't know, 6 or 7 weeks, we have exhaustively negotiated with the state, and we've resolved and come up with an allocation, intrastate allocation agreement for the opioid funds that will send money directly to the county. And as I believe with my phone call that I did this morning, we're down to just 3 jurisdictions that we need to get to sign the paperwork, and we will assure that Oregon will receive more than actually 100 and some % of the opioid funds that have been designated at the national settlement level. And that is primarily a result of the Oregon County Councils Association working with the League of Oregon Cities to get all of the participating jurisdictions on board and signed up within the timeline set by the national agreement. And I'll hopefully be providing the board with some more details on that later, but I did want to make that announcement.
No small amount of work went into that, Mr. Dingle. Thank you very much.
It was a lot of hours, a lot of telephone calls, and a lot of emails. Yes. And so I've talked about B, so I don't believe there's any discussion by the board. Chair, would you like me to move to C?
We'll move on to item 8C, which is the order 22-01-04. Diana, please.
If I can interrupt one moment, Chair Farr, we do need a vote on item C.
That's right.
Oh, we do, in fact. Thank you very much. Then we are on order 22-01-04-23 in the matter of notifying board members of emergency meetings and board participation in emergency meetings. Do I have a motion?
So moved.
Moved by Commissioner Book and seconded by Vice Chair Trieger. Did I get that order correct? It was pretty simultaneous, but I'll use that order. Then we have a motion. Any discussion to the motion? Seeing none, I will call for the vote. All those in favor, please say aye.
Aye.
Aye. Passes unanimously. Thank you, Mr. Dingle. Thank you, board. Order 22-010424 in the matter of authorizing the county administrator to expend and commit county resources during an emergency until an emergency meeting of the board. Mr. Dingle, back to you.
Thank you, Chair Farr. Members of the board, this is another one of those similar to the item that just appeared just before this. This was developed through working together with county admin and the board to make sure that the necessary resources are provided when an emergency occurs, and more importantly, that they're provided legally in the sense that because of the limited authority that the county administrator has. And this just allows the county to more quickly and nimbly respond to emergencies, but provides the necessary oversight because it contains a provision that the county administrator report at the next board meeting, available board meeting, how the funds are being spent and what they were being spent on. And again, this is routine. This is the board's opportunity to make any changes to that process or policy. That's why it comes up every January for review by the board. That's all I have, unless any of the board members have a specific question.
Thank you, Mr. Dingle. Do we have any questions from the board? I see none. Then we have before us order 22-0104-24. Do I have a motion?
So moved.
Second.
Moved by Commissioner Burney, seconded by Commissioner Bozievich, order 22-01-04-24. Discussion to the motion. I see none. I'll call for the vote. All those in favor, please say aye.
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 All right.
Passes unanimously. Mr. Dingle, thank you very much.
You're welcome, Chair.
Moving on to item 9, which is county administration. 9A is a report on the legislative committee update. Mr. Kyler is with us today. As my practice, Mr. Mulcahy, will be to turn it over to you to introduce staff.
Sure, Chair. I'm happy to introduce Mr. Kyler to lead us through this discussion.
Thank you, Administrator Mulcahy and Chair Farr, Vice Chair Trieger, and Commissioners. I'm Alex Kyler, Lane County's Intergovernmental Relations Manager. You have a packet of material in front of you that's a report back from the Legislative Committee meeting of December 2nd. At that meeting, we did several things, one of which was to discuss some additional state legislative priorities and principles for the 2022 session, and the other was to discuss federal priorities in advance of the 2022 United Front trip for the United Front partners of Lane County when we go to Washington and DC. Essentially, those changes are documented in Attachment A, which is the dynamic document that the county uses to establish legislative priorities and principles. The new items are highlighted in yellow. With your permission, Mr. Chair, I'll just walk through those new items. So
Thank
the
you.
first,
Please go ahead.
yeah. Sure. The first one that we talked about was something that came to my attention fairly late in the game, but it's a new priority for the holiday farm fire section of the document, and that has to do with ensuring that we've got adequate funding for reestablishing public survey corners in the impacted area. With the number of downed trees in particular, some of those were considered to be what are called bearing trees, And so those bearing trees, in many cases, were removed, and in some cases, corners, which can be physically located, were disrupted by tree removal and other heavy equipment use in the impacted area. Now, there is a FEMA reimbursement process that's undergoing for this, but we're not sure that it will have enough. And the public corners fee, which is established under state law, has not been increased, I believe, since its inception in 1985. So it's probably due for some legislative attention at any rate. The second item that we discussed was an issue related to under the heading of public safety, and it has to do with the district attorney's office and some cost shifting that is occurring as a result of a bill passed in the 2021 session. What we understand is that bill was not intended to do the cost shift, but it is occurring nonetheless. And so I think there's probably some work that needs to be undertaken to try to address that issue. And so we asked for it to be placed into this document. Moving on, under the heading of Health and Human Services, we discussed a bill from the 2020 session that ended up in Ways and Means and did not and stayed there for the duration of the 2021 session. It did not get to the governor's desk, but it would have created a state fund to support legal representation for immigrants when they are facing either immigration procedures or deportation procedures. Unlike criminal cases where a defendant is provided for an attorney in the immigration court, there is no similar device, and this bill would have established a fund to ensure, at least as long as the money would last, there would be legal representation for those individuals. Under the final piece of the document, we did discuss an actual priority for the 2022 session, and that's to seek $15 million in state bonding authority to further evolve the conversation around the multi-purpose facility that you've been discussing that would be developed at the Lane County Fairgrounds site. We think that the budget, at least a preliminary budget for that facility, really does require us to go after some state funding, and this would formalize your will in that matter and allow me to work with others to try to get that done during the 22 session, which is about to start in February. So with that, Mr. Chair, I'll wrap up my comments and take any questions that you might have.
Thanks, Alex, that you could keep your immense body of work to that short of a presentation. I'll look to the board for questions or comments. I see no hands raised for questions. Mr. Kyler, all you need is a motion to accept the report. Do you need anything beyond that, Mr. Kyler?
No, I do not, sir. I think it's just the motion. There is a board order associated with this, and that will adopt this new document, and that's what we would go into the February session with. I guess I should probably discuss a little bit, however, just that we did also, like I said, discuss the United Front principles and priorities, and to your last the presentation before County Council, there very well could be the Mental Health Crisis Center and trying to find some funding for that from the federal government. I want to note for the board that you're aware that in the current budget deliberations in Congress, that each House member was afforded a limited number of congressionally directed spending requests that they could include in the budget in their budget for the upcoming year. Congressman DeFazio did identify some funding for what sounds very much like a similar center to be located up in Benton County. And so it would not be unprecedented, for example, for us to at least consider that kind of facility in a future request for federal funding.
Thanks for that last part, Mr. Kyler. You know, one thing is that the work of your office is really dynamic. We never can tell at the beginning of any legislative session, whether it's local or federal, where you're going to be working. Things come up on a sometimes without notice even, and we do grant you a certain amount of latitude and authority to act without a full vote of the board, and you continually ask for that latitude, which we give to you. So with that, board, any further questions? Mr. Kyler, I'm sorry, I stepped on your toe.
No, Chair. I think that, the document is really the key to that latitude. It does set out some broadish, both broad and specific. So the broad is the principles and the specific are the priorities. And I think it's worked quite well.
Excellent. Then we do have before us, board, an order, which is order 22-01-04-25 in the matter of adopting recommendations of the Lane County Legislative Committee. Mr. Kyler, anything further on that order, or can we move directly to a motion?
I think I'm done. Thank you.
Do I have a motion?
So moved, if I may, Chair.
Thank you, Commissioner Burney.
I'll second.
Moved by Commissioner Burney, seconded by Commissioner Buck, order 22-01-04-25 in the matter of adopting recommendations of the Lane County Legislative Committee. Discussion to the motion. Commissioner Bozevich.
Thank you. I am not going to support the motion because this does include support for House Bill 3230 and using legal taxpayers' funds to support attorneys for people that have violated our national laws. I don't think it's a proper use of state taxpayer funds, and I can't support that being part of our legislative principles.
Thank you for that explanation of your negative vote. Upcoming, Commissioner Bozevich. Further debate, questions to the motion? I see none. I will call for the vote. All those in favor, please say aye.
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 Opposed?
Nay.
Passes 4-1 with Commissioner Bozevich in opposition. Thank you, Mr. Kyler.
Thank you.
Then we'll move along to further in the county administration. Mr. Mokrahajski, do you have any announcements?
Chair, just a couple of brief things. First, I wanted to, we sent out some information to our employees in the community last night and this morning, recapping some of our accomplishments over the past year throughout 2022. You may have seen the article in the Register Guard over the weekend. So just point you to that. And I will take this opportunity to thank Commissioner Burney for your leadership in the last year, and Commissioner Farr as chair and vice chair through a very challenging year. And but we got a lot done, and we're moving forward in a positive direction. So thank you for that. Also note that we are, as has been noted, testing a new platform here. We're on Zoom for the first time. That provides some additional functionality for the board and the public. It allows us to make sure that more presenters are able to be let in, and some additional functionality, which is a great thing. You'll also notice that because it's the first time we've used this tool, we've had a few bumps in the road today. And I want to thank Diana Jones, our board coordinator, for all of her work. There's a lot of work that goes on behind the scenes to get these meetings. We don't just show up here, right, and do all of this work. There's a lot of behind the scenes meeting to coordinate these board meetings, both the technology behind them, the how we operate during the meetings, and all the materials that are brought to the board. So I want to thank Ms. Jones and others who are involved in pulling these board meetings together. And particularly as we test this new platform, I noted this morning to Ms. Jones that this is a good example of failing forward, where we're testing something new, we're taking a risk and trying something new that has some additional benefits, but inevitably we're going to make some mistakes, and we learn from those mistakes. And that's where innovation and progress comes, is from that trial and error, that learning from mistakes. And so mistakes aren't a bad thing. They're actually a really good thing if we learn from them. So today is a great example of that, and I appreciate everyone's patience as we work through some of those things. I'd like to also, as you all are now well aware, next week we will celebrate Ms. Gaffney's last board meeting with us after 32 years with Lane County. There's been some information gone out saying she's been with Lane County for 20 years. It's been 32 years. She joined Lane County in 1990. So she's celebrating 32 years and retiring at the end of next week from Lane County. We'll celebrate her last board meeting next week. I'd like to take today just to announce the appointment of our new Health and Human Service Director, who will start on Monday, January 10th. And so we'll have a week of overlap between Ms. Gaffney and Eve Gray. Eve will be our next Director of Health and Human Services starting again next Monday. And we're very excited for her to join us. Finally, I will just want to note that we have some, and I'll follow up with commissioners after at a break here today with a request for your appointments to the Climate Advisory Committee. We have 3 vacancies on the Climate Advisory Committee, and we'd like to get that group, continue that group meeting going forward. And so I will follow up with commissioners that have vacancies to make sure that we can get those appointments moving forward. And once we have the confirmation from you, then we can bring them forward for the full board to approve them. So those are my brief announcements today. Happy New Year. Looking forward to a great 2022. Congratulations to Commissioner Farr and Commissioner Trieger for your election as chair and vice chair. And we all look forward to working with you in that capacity in the next year. Thank you so much.
Well, thanks, Ms. Morgaisi. We all look forward to welcoming Ms. Gray to the team, and we look. What's the opposite of looking forward? Looking backward, I guess, to the departure of Ms. Gaffney. Although I don't think you're going to go very far. I think you're going to keep living in Lane County. Any questions or comments from Mr. Morgaisi at this point in time? Commissioner Burney.
Yes, Mr. Morgaisi's remarks suggest that the meeting is over. Is that correct?
Well, there are 2 more items on the agenda for the morning. So
thank you, Chair.
Further comments? I see none. Ms. Morgaisi, thank you. We have on item 10, we have no executive session scheduled for today. Is there any other business from the board or from staff before we go into recess? I see none. We'll be recessing a little bit early today. We will return into session for a public hearing at 1:30. Thank you for participation this morning. We are recessed.